what I always say. Yeah. So, you know, when I don't.
This is a event of our strategic,
And then,
It's
oh, I like the resident.
just for me?
no, to, for the report out.
Oh, no.
Oh.
Oh. Doesn't matter.
You know, now I'm getting it.
Yes.
Well, you know what, I went every year that I've been on the board, but I honestly love it.
Yeah, he said he was.
And I was so sick, and I didn't even tell Dawn I wasn't coming. And, next thing you know, I was sick all week, but now this week was
Next
Friday, because they,
It'll be 50 next.
Yes, but you know, no, I don't think he's ever had it.
Wow.
but we gotta get through the next.
I mean, he exercises
50, 50.
hours a day. And he's really fun. Yeah, he has to get up at 4 a.m. to go to planner.
Yeah.
I didn't have to go to the Miami. Yeah. Yep. That's great.
Well, I do a lot.
Yeah. So if he doesn't go before, he goes after. And I know the minute that, I know that he's done with work, and I have 2 hours to get his meal ready.
I run the town cemetery at Valley View and all the books. So I have a lot. Crazy hats over there.
Yeah.
So, you know, people come in.
But he's gotta have everybody here. Okay.
Live and live streaming.
Yeah.
We have somebody.
Good evening, everyone. We are going to start out today with Access Family Services doing the presentation. So Mandy Larson, I'd like to introduce you, and if you want to go ahead and start for us.
Thank you. Thank you for having me. I'm Mandy Larson. I am the Director of Clinical Services for Access Family Services. That may be a new name to most of you, and I'll get into that after telling you a little bit about myself. I'm a registered nurse by background. I have my undergrad from Penn State, master's in nursing with a focus in leadership and management from WGU, and I've been with Access Family Services, formerly known as Access Point, so operating as Access Point for about the last 2 years. So many of you in the community may be familiar with the name Access Point. Access Point Community Health Centers has been a part of Summit County since approximately 1995. But in January of 2024, we joined forces and brought under our umbrella Family and Community Services, which is a large social service organization headquartered in Ravenna, Ohio, Portage County. The merger of our two programs created Access Family Services, for a full-service social service agency serving clients in over 80 programs across 3 states. Our healthcare program is focused here in Ohio under the names Access Point and Valley Health Services. We are federally qualified health centers that serve the underserved here in our community, and I'll go into that a little bit more in my presentation. But I did want to give a little bit of background and understanding of where the name has come from and why the change from the name that many of you in the community are familiar with. Additionally, our family has grown, and as of September of 2025, Children's Advantage, the child and adolescent counseling services located in Ravenna, Ohio, are now also a part of our organization and under our umbrella and are operating as federally qualified health centers. So with our new name, our new family, we updated our mission and our vision, and we really are here to connect communities and people to health and supportive services that they need, really as a coordinated effort. Access Point Community Health Centers, as I had mentioned, has been in the community providing healthcare services to our residents for over 30 years. We started back in 1995 as Akron Community Health Resources, grew, opening several locations under that name, and Access Point Community Health Centers, the first federally qualified health center in Summit County. So federally qualified health center means that we receive federal funding to serve as a safety net, provide health care services to those who are underserved. We are not a free clinic, open-end clinic. We are a community health center. Everyone is expected to pay something, but services are offered on a sliding fee scale. Here's some more information about our service sites. We actually are approved to provide service at over 10 locations, including a mobile unit that can do dental and medical across 3 counties. We're in Summit, Portage, and Trumbull counties. We have the 5 full-service health centers that you see here, with additional services opening in Youngstown and soon Ravenna, Ohio. A full-service health center means we provide medical, dental, pharmacy, behavioral health, all under one roof at the same address and location. Additionally, our 2 Akron offices located on Arlington Street and over on West Market Street in conjunction with the LeBron James Family Foundation offer optometry, all on that sliding fee scale. No one is turned away for any inability to pay. We are here to care for all of our residents. I'm going to come through some of the services offered in the different service lines so you guys see an understanding of what we can help you with as residents of the community and advocates for our community. Additionally, I'll try to point out some of the partnerships that we have specifically with the health department here, so you can see how that collaboration improves the overall health of our neighbors. So in medical, we do acute and chronic treatment of health conditions, medication and assisted treatment services, women's health, pediatric services, all your point of care testing, offer same-day appointments, everything that a primary care provider would do. Particularly for Summit County Health Department, we have a great relationship with the TB clinic and those that screen positive for TB and need ongoing treatment and monitoring. Those patients can be referred over to us, seen at any location that's convenient to them, to get treatment and continue to be monitored for their treatment. Our dental services, we offer now advanced services in dental at both our health quarters and Warren locations. We're doing full service dental. We can do crowns, dentures, partials, flippers, mouth guards, teeth whitening, in addition to your typical cleaning, filling cavities, things like that. It's a great resource to our community. Those who are underserved or receiving Medicare, Medicaid services, they can only receive a denture for payment through that program only so many years. We all know dentures break, they get lost, things happen to them. We can provide dentures on a sliding fee scale. So in a regular community setting, dentures are many thousands of dollars, $5,000 to $6,000. We provide them on our sliding fee scale for $1,800 and offer payment plans. Additional hardships as well. Our optometry services, as I mentioned, that's located at Arlington Street location, as well as our West Market location. We do full eye exams, managing of chronic eye conditions like glaucoma, things related to diabetes. We can prescribe both glasses and contacts, but we do not dispense the glasses or the contacts. We will give you a prescription and connect you with the community resource. It requires a lot of space. If you've all been to an eye doctor and seen all those beautiful rows of glasses, that takes a lot of space, and for a small nonprofit to be able to allocate space to that is a challenge, but we're hoping to do that in the future. We started this program in 2020. Our pharmacy is a great benefit that we can offer. We offer full service pharmacy. We are not open to the public. Patients, our consumers do need to see us for primary care in order to utilize our pharmacy. But our pharmacy operates on the 340B program. Many of you may have heard of that recently. It's been in the news, some changes to that rebate program. They're making us a little nervous about that. Right now, these drugs are provided to us from the manufacturer at a significantly reduced cost. We turn around and pass that cost on to the consumer. So for some of our patients who have asthma or COPD, those new inhalers that you see the fancy commercials for, $500, $800 plus at pharmacy. For someone who is on Medicare and deciding between a prescription and food, we can provide that inhaler at about half the cost. So it's a great service, we can do that. Additionally, our pharmacists are all clinical pharmacists, so they can manage complex and chronic conditions, diabetes, hypertension, Hep C is a huge piece, Hep C treatment. And we also offer MedSync at home delivery. So if we have a patient who has 5-6 medications, our pharmacists will work to get those refills all synced up at one time, deliver all 5 or 6 of them directly to the client's home. So transportation is not a barrier to receiving medication. Payment is not a barrier to receiving medication, and our community can remain healthy. A little more about us specifically and who we see and what we see for in any of these services. We treat patients of all ages, cradle to grave, birth to death. We do have a pediatrician on staff. Our pediatrician currently sees patients at both our Akron locations, and we'll be expanding into our Ravenna location in May of 2026. We target the socioeconomic population that is underserved, but we take all your traditional commercial insurance plans, and all the benefits of our programming are available to all of our clients regardless of insurance. So about 55% of our patients are Medicaid, 15% of our patients are commercially insured through an employer, about 15% are on a sliding fee scale, and the remaining are Medicare. Our Chief Medical Officer, Dr. Edwin Scott, who some of you in this room may know, he likes to say that he cares for everyone from the homeless gentleman that lives on the corner all the way up to some of the CEOs of our major corporations located in Akron and across the nation. Here are some of our collaborations that we have. We do have on-site laboratory services through either Quest Diagnostics or Three Rivers, depending on what location you're seeing. We contract with Tiffany's Mammovan to come out quarterly to all of our sites to provide on-site mammography. We have great student relationships with Kent State, Akron University, and Neomed, getting students from all of these avenues, create a pipeline to provide learning opportunities for our community. We work with Coleman Health Services at our health quarters location, and again, the LeBron James Family Foundation. So the LeBron James Family Foundation, Kindergarten Executive Director Mark Brazone said we need a healthcare partner in the area. Can we partner with you? That could be a positive partnership. We partnered with them. We've opened a health center at 527 West Market Street, directly across the street from House 330. We provide the full medical, dental, pharmacy, optometry, everything in that building, and we partner with Coleman. They provide the behavioral health, but it's all under one roof. We make it a seamless experience for our patients as possible. They really don't see the distinction. We are not just limited to the LeBron James Family Foundation families or those connected to the foundation. We are open to the community and anyone in that local community to receive care in that building. Some additional services and what sets us apart from some of our other local larger health systems or other private primary care offices in the area. Again, our federally qualified health center, our health center designation through HRSA, our grant funding does allow us to provide sliding fee scale. We have community health workers that are out and about in the communities. They're all working with local mobile meals programming to check on our seniors and connect them with services as needed. We offer food pantries at several of our locations in addition to hygiene closets. We also offer transportation to and from the patient's home to any one of our sites, any one of our services. I have some pictures of each of our sites and the locations here and a phone number if you need to write it down. But our Arlington location is right on Arlington Street in the Arlington Plaza. Very convenient there. The location in Barberton on Robinson Avenue, about a block down from SUMA, closer to just off 5th Street there. Very conveniently located. Our Health Quarters Foundation in conjunction with the LeBron James Family Foundation. I'm going to get a lighted sign there. Our location in Kent. And then we have the 2 additional locations with the adding of Children's Advantage on in Ravenna. Those are just primarily focused on behavioral health at this point. This location here that you're seeing displayed on the screen is our only full-service location currently in Portage County. We are opening another one in May. And then this is our Valley Health location. So also under our umbrella is Valley Health Services. They're out in Trumbull County. They were historically known as a behavioral health provider in that area for over 50 years. They came under our roof. They all operate now as federally qualified health centers. And this is a picture of their location in downtown Warren. We can do, it's a 3-story building as you see. The top floor is all substance use disorder treatment. Second floor is behavioral health. And the first floor is special ground. That concludes a little bit about Access Point and who we serve and how we can partner with you and how we can support residents. Are there any questions? Anything I can answer for anyone?
I'd like to make a comment.
Yes.
I'm a client. I go over to the clinic for the last 2-3 years. Excellent place to go, get excellent treatment, very clean, very professional. They need to go outside, they need your appointments pretty quick. I praise this for Dr. Scott, who I know personally too, over there. Dr. Maslow, it was my doctor who quit to Cleveland Clinic and decided to basically donate, more or less donate services pretty much to the clinic. He said I had to get a new doctor. And I said, well, why can't I come with you? And I did that, and I'm glad I did. It's an excellent facility.
Any other questions or comments? Okay. Thank you very much, Mandy.
Call the meeting to order. Roll call, please. Blakeslee?
Here.
Chapin?
Here.
Dr. Cook?
Here.
Dr. DePompe?
Here.
Ganell?
Here.
Ms. Jindalsberger?
Here.
Ms. Hayes? Here. Mr. Karan?
Here.
Lowry?
Vote.
Mr. McGuire?
Aye.
Dr. Mamona?
Here.
Mr. Sundaral?
Here.
Mr. Snell?
Here.
Mr. Somerville?
Here.
Dr. Varian?
Here.
And Ms. Williams? Here. Thank you.
So the next is a motion for unanimous consent. If I can have a motion to conduct business by voice vote unless a roll call vote is specifically required by our bylaws, state law, or is required by a member of the board. Can I have a motion?
McGuire seconds.
Are there any comments or questions on this? This is just because it is live streamed now, and so we may have issues where we need to do a roll call vote, but we just want to have this motion so that we can go forward. Okay, any other comments? All those in favor?
Aye.
Opposed?
Roll call.
Oh,
Yeah, on this one.
okay, on this one, we're doing roll call. Okay. Dr. Blakeslee?
Yes.
Yes. Chief Lee Chafin?
Yes.
Dr. Cook?
Yes.
Dr. DePompe?
Yes.
Mr. Ganell?
Yes.
Ms. Gindelsberger?
Yes.
Ms. Hayes? Mr. Courant?
Yes.
Mr. Lowry?
Yes.
Mr. McGuire?
Yes.
Oh, myself, yes. Mr. Centerack?
Yes.
Mr. Snell? Mr. Somerville?
Yes.
Mr. Varian? Ms. Williams? Or, I'm sorry, Dr. Varian. Okay, this motion passes. Can I have a motion for the approval of the Board of Health meeting minutes from February 12th of 2026?
So moved.
Any discussion? All those in favor?
Aye.
Opposed? Any abstentions? Okay. Next, we have public and staff comments. I would like to welcome Kyle Salisbury and James Hayduck we are going to ask for your comments when we actually do the variance during environmental health. But if there are any other public comments, we can take those at this time. Okay. Can I have a motion to adopt resolution number 011-26 entitled Approval of the Consent Agenda, Schedules, and All Matters on the Consent Agenda? Any discussion?
I have a question, from Janelle Colner, who's not here tonight. She was looking through some of the travel expenses and sees that, there might be 2 individuals or 3 individuals who are going to Columbus, and each of them has asked for travel mileage, and she's wondering if there's such a thing as carpooling, or if everybody gets mileage if they go, or how that is handled, and why each individual is asking for mileage.
So with the outside travel request approvals, staff cannot be reimbursed for more than the board approves for travel costs. So in the event that something were to happen and they had to travel separately, we would have enough approved to cover any travel costs. But generally, we require staff to carpool or even take a company vehicle if it's available.
Thank you for the clarification.
Any other questions or comments?
How much amount do they get?
70 cents, I believe, is the IRS rate.
Yes, I believe so.
Any other questions or comments? Okay. All those in favor?
Aye.
Opposed? Any abstentions? Okay. Committee reports. Community Health and Wellness. No report. Finance. Ms. Hayes.
We met on February 12th. We approved the minutes. We also, it was Clay's last meeting, so we wished him well on his next journey. And we talked about the county budget that is coming up with a meeting on April 16th. We also did some discussion around dashboards and metrics and what board members should be focused on. So I think more to come out of that as we continue through these meetings, but trying to give a more summarized version of 40 or 50 pages of documents. And then we really wrapped up kind of quickly to get to strategic planning. That's our report.
Okay. And then Governance Committee, Mr. Snell.
So we reported last month that, and I'll move to, appoint Chrissy Schindelsberger as the board president for a 1-year term starting 4/1/2026, ending 3/31/27. We will miss you, Dr. Malone. But, so that's a motion. So wait a minute a second.
Second that.
Any discussion? All those in favor?
Aye.
Opposed? Any abstentions?
Okay, so then congratulations, and then we will also make the motion that we made last month, the recommendation, a motion to appoint Patrick Blakesley as president pro tem for a 1-year term, the same period of time. We need a second. I'll second.
Any discussion? All those in favor?
Aye.
Opposed? And any abstentions?
Congratulations to both of you.
Yeah, congratulations. Yay. And then Human Resources, no report. And then Strategic Planning.
Yes, I have a report. So, we met with a group of very talented, colleagues, and totally amazed at the amount of work that goes into the strategic plan. I don't know if any of you have done strategic planning before. I have, but not for this kind of an organization, and it does take months, if not years. So we had 6, and I'm just gonna fly through these because I don't want to give you the full hour report. But here's some of the things that we look at for our strategic plan. We look at cybersecurity and business continuity focus. We look at ensuring public health services are addressing targeted intervention or providing stopgap services to the public. We also look at modernizing public health practice through quality improvement, data innovation, and interoperability, and I won't go into all the bullets under that. Also foster employee engagement, development, and performance. and there's quite a few bullets under that. Develop and advocate for evidence-based policy practices and programming. And finally, strengthen the financial sustainability and fiscal stewardship. So what I would encourage you to do is to actually, I think, was that strategic plan over there on the table?
No, that's our annual report.
Oh, the annual report. But I would definitely look at a previous strategic plan, because this takes a lot of time and effort. And I'm just really, really happy to be on this one. Thanks, Alex.
Any comments? We do want to shout out to our strategic planning team, because
Oh, yeah.
they go above and beyond and do a very exceptional job. Health Commissioner report.
Okay, thank you. Good evening. Following this meeting, the Human Resource Committee will be meeting here in the boardroom. Community Health and Wellness Committee is scheduled to meet April 9th following the Board of Health meeting. We conducted the District Advisory meeting, which occurred on March 2nd here at Summit County Public Health. Mr. Jeffrey Snell was reappointed to the Board of Health as a representative for the General Health District, serving a 4-year term. His term is April 1st, 2026 to March 31st, 2030. We also appointed the election of officers, which is a requirement each year. Barberton Mayor William Judge will serve as chair. Bath Township Trustee Mr. Sean Gaffney will serve as secretary. Boston Township Trustee Ms. Amy Anderson will serve as a committee member. Clinton Mayor Bud McDaniels will serve as committee member, and County Executive Eileen Shapiro will serve as the third committee member by virtue of her office. In regards to program and fiscal updates, a copy of the 2025 annual report has been provided. It will also be posted to our web tomorrow. We did receive a congratulations letter from the Center for Disease Control and Prevention for achieving reaccreditation. I can pass this letter around. And also wanted to highlight, Summit County Public Health hosted representatives from 7 nations. We are in a partnership with Global Ties Akron. These individuals were representatives from a health background in government positions, practicing healthcare, or in academia, and interested in learning about public health services here in the United States. It's a very good service. We've been doing this for several years. That concludes my report, unless there's any questions.
And then we will move on to the fiscal report.
So as Jennifer stated at their February meeting, the Finance Committee reviewed the proposed 2027 general revenue budget. The committee voted to recommend the proposed budget to bring tonight to the full board for approval. The Board of Health adoption of this ensuing fiscal year's annual general revenue budget is identified as a requirement in Ohio Revised Code, Section 3709.28. Projected operational expenses and anticipated sources of revenue must be itemized within the budget for the Budget County Commission to approve. The Board of Health approval of the budget is required to be completed annually by April 1st as a requirement for submission to the County Budget Commission. So the proposed budget and the backup documentation has been provided to you in the packets. And at this point, I would just need a motion of support.
We have a motion to support the 2027 general revenue budget.
Second.
Any discussion? Any questions? Okay, all those in favor?
Aye.
Opposed? Any abstentions? Okay.
The next, the 2027 budget hearing with the County Budget Commission is scheduled for April 16th at 10 a.m., and that is at their temporary location at 470 Grant Street, which is the Elections Building. All board members, of course, are invited to attend. It's going to be in person and or virtual. At this point, I don't have a virtual link yet. That will be provided by the Budget Commission, and I don't have the room number, but I will provide that information as the time gets closer. Next, the 2026 All-Staff Picnic and Year-End Appreciation Breakfast. So I would like to request a motion for support of that.
Can I have a motion to support the 2026 All-Staff Picnic for the 2026 Year-End Staff Appreciation Breakfast in an amount not to exceed $6,000?
So moved.
Second.
All those in favor?
Aye.
Opposed? Any abstentions?
So the picnic date has been set for August 26th, and it's expected to be held here. It's been held here last year and in years in the past before that. And of course, board members are welcome to attend that as well. And then finally, the monthly financial reports have been provided in the packet. I can answer questions on that. Just as a side note as well, the unaudited 2025 financial reports were submitted to the Auditor of State by the March 1st deadline, and our annual financial audit is scheduled to take place in late April. That concludes my report unless there are any.
Any questions or comments? We are going to move on to environmental health. At this time, I would like to allow Kyle and James public comment. Just a reminder for the rules that the comments are limited to 3 minutes per person. Comments we expect to be respectful, and only one person can have the floor at a time, and all this should be directed towards the board members. Do you want to present first? Actually, I take that back. We're going to go ahead and present first, and then maybe give the board members a little bit more of a scope on what you're going to say. So. Everybody. So tonight's So the proposal tonight is for both a sewage treatment and a private water system, various requests. 3585 Mall in Coventry. So this address may be familiar to some of you. In 2021, the board graciously granted a variance to replace the sewage treatment system at the existing home on this property. The variance was never acted upon and the system was not replaced. So it is still the same system that was requested to be replaced in 2021. This request is completely different from the 2021. Got it. So,
Better advanced one slide.
there we go. Okay, so this is the proposal. This is the proposed home is the black dashed line. Here is the existing septic tank and leach well, and the proposed replacement sewage treatment system. This is the water well for their neighboring property to the south. You can see that the proposed system is within the isolation distance, 50-foot isolation distance from their neighboring well. Their proposed well is, replacement well is here, their existing well is located here currently. Variances requested also are encroaching on the property line to the north. A few other things about this request is that the majority of the proposals that we have presented to you in the past were for occupied homes, and typically with failing septic systems that are creating a public health nuisance. Siting of systems in those situations were physically impossible due to the existing home and the limitations on those sites. So denying those variances would have left residents either without running water, if it was a private water system request, or requiring them to vacate the home to abate the public health nuisance. In either of those situations, under Ohio Administrative Code 3701-2922, both of those could be considered circumstances that are unusual and create an unnecessary hardship
which is a requirement in our sewage treatment system and private water system in order to grant a variance. This case is different because the applicant intends to demolish the home, the existing home, and rebuild. So once the home is removed, parcel essentially becomes vacant land. And both the private water and the sewage treatment system rules require vacant parcels to adhere to every section of the code. By tearing the house down, you're creating a blank slate, and so the code compliance is mandatory, no longer optional. In 2025 alone, here in Summit County, we approved septic designs for 21 homes that went through a similar process. They tore their existing home down and replaced it with a new structure. All 21 of those systems were approved without variances. So I had asked our staff to look at this and come up with an alternative sewage treatment system. We wanted to see, is there an option on this lot to replace? And there is. So in this slide, again, the black dashed line is buildable area that could be used while siting a new well and a new septic system that did not require any variance. They could site a sewage treatment system here outside of their own new private water system as well as their neighbors. And they could site a new drinking water well here, and there's no encroachment on any of the neighboring property lines or existing systems. So, yes, while the layout is not perhaps what the owner may want aesthetically, it is feasible. And, I mean, we've learned, even with all of those 21 homes that I discussed, that not every parcel is capable of supporting every design of a home, especially when you're looking at properties that don't have public sewer or public. We have been working with the owner and Kyle for months. I advised them early on that our recommendation would be not to approve these requests. I offered to refund their application fees, let them move forward either with replacing as we approved in 2021, or coming up with a different proposal if they want to try and build it. So it is the opinion of the staff here at SCTH that approving these variances would set a precedent that not only would conflict with the private water system and sewage treatment system codes, but it would also go against the, what we have done previously and consistently across the county. In addition, it would violate 3701-29-22. I'm just going to read. It states, "Board shall not grant a variance that would defeat the spirit and general intent of this chapter." And we believe that allowing new construction that doesn't meet the code and bypasses isolation distances defeats the spirit of these public health protections. So our recommendation would be to deny. I also want to note that should the board go with our recommendation and deny the request, the owner will still maintain a right to request a hearing. That's pursuant to 3718.
Questions? I just have one. Are the black dotted lines where the new structure, so it looks like a structure and then a walkway and then a structure?
This is, yeah, I mean, it's not a proposed structure per se, but it does
That's the
show
area,
that, I
yeah.
mean, they have currently a detached garage. They could do something similar. They could build vertically, on a smaller footprint, maintaining a detached garage, or, I'm not, but they could create some kind of way between there. That's basically areas that could be used, and still meet all of the code requirements.
So there are two septic designs, theirs and ours.
Well, ours isn't necessarily a design. What I
Or
wanted to,
proposal, or
yes.
where things should go.
right, I wanted to show that it is possible to tear the house down and rebuild something that meets the code.
And what they had proposed would not be.
That's correct. Either of them,
What's the tear down?
correct.
What is their logic? Do we know?
Well, they're
Well,
gonna talk with us. They're gonna talk with us in a
Don't
minute.
speak to that.
Okay. Go ahead, Mr. Snell.
Sure. So I just have a couple of questions. So I'm not a fan of any of these variances, and all of these areas down here are tough for me every single time. Normally, I think designing or laying something out, in the normal case, if there was no structure on that property, would it meet our code? And I guess that's what you looked at, is that way you did that? You looked at it to say, if there was no structure and you started again, this is kind of the thing. And then I was confused by these. And I see that one, you actually figured out the square footage, which would be, and I went to this parcel, and I'm gonna ask you guys about that too when we get here. But your parcel is, your house is 928 square feet with 572 feet on the first floor. And it was built in 1923 because these were cottages. So the one you proposed is like 1,300 and something. So there is a way to rebuild without a variance. Okay, because I think most of these seem to me impossible to build at all. That's how I view it, because it's incredibly tight all the way around.
Ms. Williams?
Yes, my question is, you said that they, were approved in 21, and we're now at 26. Was there any particular reason why they didn't move forward?
No.
I mean, has the property been sold?
No, this is the same owner that requested the variance in 20.
Don't we have a period of time that it has to be completed?
Not necessarily, they didn't, even apply for a permit. So the process is that this variance would allow us to approve a design plan for them to then get an installer to apply for a permit to install the system. And that next step is never taken.
Okay. Do we have any other board questions? Go ahead.
Were they going to tear down the home back in 21?
They were not.
That's the difference.
Correct. It was an existing home.
Barry?
Any input from Coventry Township on zoning, or
I have not heard.
haven't heard anything come in?
I believe that Kyle has information that they may have.
The zoning administrator.
Okay, if there's no other questions from the board, I'm gonna go ahead and open up for public comment. And again, we have 3 minutes for each of you.
You go up there.
You can go wherever you like, wherever you're comfortable.
James Sadek, I'm the owner of 3585 Mong Avenue. I purchased the home back in 2020. It was originally a weekend and summer home, as our main house was down in Columbus. Back in 2024, my wife and I and our 2 boys moved permanently to this property, and have since then discovered that it doesn't quite work the way that it did when we were just there on the weekends. The home is extremely small. Like I said, it was built in 1923. It has a lot of old issues. The retaining walls that are on the lakeside are all deteriorating, and one has already collapsed. There is only one small bathroom in the house currently that all 4 of us have to share in the morning, getting ready for work or school. The kitchen is tiny without any kind of countertops. There are foundation issues, especially on the lakeside, where the house had shifted a long time ago and now have slanted floors on both the upper level and on the main level. Like I said, it has a detached garage, and the well is in the basement with little water pressure. So there's a lot of work that really needs to be done for us to continue to live there, is our feel. A new property that we've, a new house that we've contacted our builder about would solve many of these issues and allow us to continue to live in the house, live on the property, and live in the community. So.
Great, that's only 2 minutes.
So as far as the septic system and the well, and the reason why we're asking for the variances, the existing water well is within 10 feet of the house. It's like right next to the house, which doesn't meet the 10-foot setback. It's too close to the south property line. It's not accessible for maintenance or repair. There is a problem with the existing well, and it is within 50 feet of the existing leach well for this house. And my understanding is the separation distance for a water well to a leach well is supposed to be 100 feet by the current code. So that's one of why we want to replace the water well. And honestly, we don't have to tear down the existing house to replace the water well, but we would want a variance to locate it in. We're trying to ask for the minimum variance we need for the new well, which would be 2 feet off. And then for the septic system, the leach well is no longer an approved septic system in the county. You can't install a new leach well anywhere in the county. And the site did get approved for an NPDES permit to discharge in 2021, and it has a permit number. Ohio EPA did approve that out of their Columbus office. And we would like to install a new system that would meet current code. A variance was previously granted for the system, and we want to more or less follow that. The variance we're asking for is actually a couple feet further away from the water well on the property to the south than what was previously granted. And for constructability reasons, we want to be further from the retaining wall on the property to the north, so we don't cause any issues there when we're putting in the new tank. And so we are also asking for a variance from the existing walkway down to the lake. The code requires us to be 10 feet away from a hardscape or sidewalk, and we're asking for 6. So that's the variances. And then you had mentioned zoning. We do have an approval letter from Robert Henwood. We did ask for variances for the proposed house. The 2 side setbacks, we cannot meet the 8-foot side setbacks. The lot's only 35 feet wide at the right of way, and the house is 24 feet wide. And the size of the parcel, it's a substandard lot, and so we had to get variances because of the lot being substandard. So, and I have his approval letter here. The variances were approved by the township, so they have no issues with those houses. And we'd be happy to answer any questions you have, and it sounds like you have some.
Okay, I'll open it up to questions for them, please.
I have probably a few questions. So I heard then, you're James, and Pajak, and then are you Kyle?
Yeah, Kyle Salisbury. I work at Lewis Lane Professionals in Boston.
Okay, so you're their consultant. You don't live there.
No,
I was trying to figure that out. That's all. I was very confused. So, James, maybe these are directed more towards you. Call me John. So, you bought the house in 2020, and it says it wasn't exposed to the open market. It was purchased by Stephen Kisha. Is that somehow related to you?
No.
Okay. So you purchased the house, $249. It had a failing system, and I realized you were using it for the weekend. What happened? Why didn't it get replaced for 4 years?
We had contacted a number of listed septic companies to replace it. Multiple came out, looked at it, said no thanks. The one company that did was the one who filed the permits and the plans with you, who eventually just stopped communicating with me through email or phone calls. He pushed it off and off and off. You know, he had other projects to do, apparently.
So my concern is, like, it took 4 years, and then you moved into the house, which put more pressure on that system that was a failing system that was supposed to be replaced. I guess, can you work with the I think these lots shouldn't be permitted at all, because they were cottages in 1923, and they were not intended for this kind of use, but it all happened down there. I will never go in the water, ever, ever. And, I don't think anybody around this room will. Like, you know what I mean? Like, we hear a restaurant that has a lot of problems, we're like, maybe I won't go there next week. The same kind of rule applies. I really have a problem in granting any kind of variance. I mean, I appreciate your circumstance, but I almost wish that had happened before you moved in and put more pressure on the system, because the system should have been replaced 4 years ago. And I get it, maybe there was a problem with the contractor, but it's kind of hard for me to stretch, 1,200, 1,400 days. That's a long time. And now you moved in it, and I assume you have a family, and there's all kinds of pressure. So I don't support the variance at all. I actually don't think you should be able to rebuild the house anywhere on the lot, but I could work with that if that was something that was there. But something has to be done on that lot with the current septic system, because it's failing. And we have a duty, and our staff has a duty, to make sure that those systems are replaced. And I think you've got like 4 years of rope that was a long, long time. And I don't think the excuse of, well, I can't find a contractor is really an excuse. We've had these problems. We've taken people to court. We've forced those systems to go in, and there are lots of people in this county to replace it. And now the system is totally stressed with all these people in this house. I think there's other methods to do that. So that I'm voting no, and I am not approving this alternate system, but it looks like you have a possibility, and I don't even think you need to be doing this, but I appreciate that you designed something potentially as a workaround. But I'm voting no.
Is the major issue that if the systems were put in the code, that the house, the land left over would not be enough for the size of the house, or is that the basic?
Correct.
Sheila?
You gave an alternative plan where there wouldn't be any variance. He's asking for approval from us with variance. I want to clarify that.
I wanted to just touch on, if I may, for a moment, something Kyle mentioned as far as the difference in the location of the newly proposed septic system versus the 2021. Because these are completely different situations. When we are looking at a replacement system, we are severely limited by what is there. Those restrictions are gone when you tear a house down. And it's the expectation is that whatever is built on that property meets all of the code. And that's a rule we apply consistently.
Can you leave a wall up?
I can talk to my builder about it.
But I think the question is different than leave a wall up.
Right.
How different is the house from 928 feet and what you want to build? No, there's 1,300 on her plan. How big is the house that you're gonna put on there? Because that house that is on there now is 928 square feet, and 572 is on the first floor. So I see the square, it's a whole lot bigger. Is it 2 stories?
2 stories with walkout basement.
And so how large is the new house?
1,500 square feet.
On the first floor?
No.
Right now, there's a detached garage that sits in the front, which is about 20 by 20, it's a little less. And then the existing house, which, 572 square feet is the footprint, first floor footprint on the back map. And then there's also a screened-in porch on the back that's 10 by 22, 220 square feet. So the existing house is 792 square feet, including the screened-in porch. And then if you add the garage, that's a total of 1,164 square feet. And what we're doing is we're combining the house and the garage into one structure. And so that would be 1,536 square feet. Footprint, not the total square footage of the house, including, you know.
Well, 3 floors of 1,500.
No,
But the outline of the structure is 1,530.
But it has a walkout basement, and then above it, there's structure. So there's 1,500 on the first floor. There's currently 572 plus arguably a screened-in porch of 200 square feet, which is really not living space. But, you know, my inherent problem in this is you're putting a much larger structure on a very small postage stamp that, you know, we can accommodate what's there. We did, and that didn't happen. And you can't expand the problem.
Hey,
My concern too, similar to yours, is going back to your original comment, setting precedent when there's no need to. To me, that I don't like to get behind things where you have to set precedent when there's no reason to. Especially if there's someone who had waited 4 years to Jeff's point to try to get this done and hasn't gotten there yet.
Barry?
As a zoning administrator myself, the idea always comes to me, well, can I leave a wall up? We don't allow that anymore because basically, if you're tearing it down, you're resetting the clock. We look at it as a brand new project. Most people do tear them down and want to leave a wall. The wall's from like probably the 1920s, so it's not going to meet any kind of codes anyway. So I don't know. I deal with this kind of stuff almost every day. I used to have black hair, now I have white hair. So, I mean, because we have the lakes in New Franklin too, and I deal with it all the time. Everybody's always trying, my joke is they're always putting 10 pounds of crap in a 5-pound bag.
Well,
That's what it is.
what I would like to express to you is that the board does whatever we can do, possibly, safely, to keep somebody in an existing home and make their wells and their water system work. So we do try and look for every variance possible to keep those people in, to bring things up to code, to make things safe for the environment. Our bottom line is that we have to do what's best for public safety. So my understanding, and I want to clarify this, is if they tear down that structure, then it's considered an empty lot and it must meet all code, correct? So that would be new home construction. So again, we need to follow the rules. We do try really hard to keep people in the homes, to keep the septic systems working. But it sounds like this is a black and white. If you're tearing everything down, then it would be considered a new build and you would not meet any of the codes. Does anybody else have any other comments? Okay.
So I would make a motion to approve resolution, is it 01326? Is that right?
So I have two resolutions. So you're going to make a resolution to deny? So can I have a motion to deny resolution number 012-26, denying the issuance of a variance for James and Janelle K. Duck, I'm going to say it correctly, at 3585 Mong Avenue, Coventry Township, parcel ID 19-06249, Summit County, Ohio, 44319, for the installation of a new private water system. Do we have any further discussion on this? All those in favor?
Aye.
Opposed? Any abstentions? So we are going to deny that motion. I do have a second motion. A motion to deny resolution number 013-26, denying the issuance of a variance for James and Janelle at 3585 Mong Avenue, Coventry Township, parcel ID 19-06249,
06249, Summit County, Ohio, 44319, for the installation of a new sewage treatment system. Any discussion? All those in favor? Opposed? Any abstentions? So we do deny this resolution as well. We do want to let you know that, as an owner, you can request a hearing to be scheduled within the next 10 days. Okay?
Thank you for your consideration.
Do we have anything else in environmental health? Okay. Clinical health and medical directors report.
First, we have the communicable disease and influenza surveillance report, and I can take any questions.
Okay. And we do not have to adjourn to executive session, but I did want to bring out, so I am going to pass out, we had to do some switching for Board of Health committees to try and accommodate requests from new members. Since Janelle will be taking the president position, then she will not be able, obviously, I'm sorry, Chrissy. I'm looking at Janelle on the thing. Chrissy is going to be taking the president position, so she will not be able to be chair or vice chair. So for the new committees, when you meet for the first time next month, we're going to have to just re-vote for who you want for chairs and vice chairs. Okay. Yep, if there's extras, yeah.
I have one, so.
Okay. Okay. Yeah. If there are any other comments, questions?
Yeah, thanks. I can't believe it's their last meeting. It's been 2 years. We appreciate it.
And so the meeting is adjourned. And we will have the Human Resource Committee here in a few minutes.
I'm going to join the
Okay.
regular people out here. And she can listen to Dr. Varian and go, that's gross. Yeah, it's a good job.
Yeah.
I can take it back. Where is it?
I present, okay.
How do you guys determine your present?
Walking back to that field. Too many kids. I figured you were walking to the field, and I was like, oh, I know. But I was on the wrong side, you know. And,
I just wanted to make sure it's
No, it's a good call. I mean, they're great.
So I
you
was,
understand why I just felt pissed? And then
I
what
was
really
like,
pissed me
okay.
is you have not replaced. To be a doctor tomorrow morning. You're down here and you move people in, and it's 900